Today on Farm News, we're going to talk about a very serious topic, an anti-cancer agent known as mitoxantrone, also known by the brand name Novantrone. An outline of what we will discuss today is the medication's drug class, anti-cancer mechanism of action, adverse effects, drug interactions, pharmacokinetic features, and the primary mechanisms of drug resistance. This is Madison continuing the reporting on this interesting drug known as mitoxantrone. Mitoxantrone belongs to an anti-tumor class known as the anthracyclines. Mitoxantrone is actually a synthetic anthracycline. It is synthesized from the drug doxorubicin. Other drugs that belong to this class are daunorubicin, idarubicin, and epirubicin. This class of drugs are known as cell cycle nonspecific drugs, or CCNS drugs, which means they are cytotoxic during the entire cell cycle process. Officials say mitoxantrone is actually a pretty old drug. It was formulated in the 1980s. Now let's take a look at a few of the structures of these anthracyclines. Here we can compare the structure of a few anthracyclines, starting with daunorubicin on the far left, doxorubicin shown in the center, and mitoxantrone on the right of the screen. We can see these medications all share a similar backbone and makeup. A little fun fact is that these molecules are actually structurally similar to the tetracycline antibiotics. That's pretty cool. But there are definitely some changes among the molecules, especially from the synthesized mitoxantrone from the doxorubicin. Because normally the anthracycline class is known for having the distinctive aglycone portion and a sugar portion in its structure. Due to this bulky structure, most anthracyclines are orally inactive and must be given as an IV. But the question is, why was mitoxantrone synthesized from doxorubicin in the first place? Mitoxantrone has such a similar mechanism to doxorubicin, but exhibits way less cardiotoxicity in patients taking this medication. Cardiotoxicity is actually one of the main side effects experienced from these anthracyclines. So mitoxantrone can also be used in the patients who are not able to tolerate the adverse effects, especially the cardiotoxicity from doxorubicin. Or mitoxantrone can also be used in patients where they have reached the lifetime dose of doxorubicin. So we keep talking about this cardiotoxicity caused by anthracyclines. Well, it's very harmful to our patients, and it involves the formation of cytotoxic free radicals, which are very, very high reactive species with an unpaired electron. These radicals actually break single strands in DNA, which is really desirable for cancer treatment, but toxic to the myocardium. Here we can see the bulky anthracycline molecule, which is converted through NADPH in the CYP enzyme known as CYP450 into the anthracycline hydroquinone. During this reaction of the reductase, there is a superoxide radical anion formed, which you can see in the middle of the screen. After further reduction through superoxide dismutase, this forms hydrogen peroxide, which can be catalyzed into water and oxygen and will produce no harm on the patient. However, when the hydrogen peroxide is used with iron to form a hydroxy radical, a hydroxy, and iron, then that is where the cardiovascular toxicity comes into play. And it's the CV toxic pathway, where the OH free radical is formed. Anthracyclines and mitoxantrone's mechanism of action occurs by inhibiting topoisomerase II, which is also known as DNA gyrase. This is an enzyme that is responsible for the uncoiling and repairing of the damaged DNA. With a decreased function in topoisomerase II, RNA is no longer able to synthesize the uncontrollably growing mutated cancer genes. Now that we have reported on many aspects of this drug, let's hear from our other anchors to further discuss mitoxantrone. Next, we will have Jason talking about the clinical uses and side effects of this medication. Over to you, Jason.
Thanks, Madison. Mitoxantrone is commonly used for treating acute myeloid leukemia, non-Hodgkin's lymphoma, breast cancer, gastroesophageal cancer, and prostate cancer. Common side effects for patients taking mitoxantrone consist of nausea, vomiting, and diarrhea. Other side effects that may be experienced are myelosuppression, which is bone marrow suppression, hyperuricemia, which means there are a high amount of uric acid found due to the rapid lysis of tumor cells. Also, cardiotoxicity. This is experienced to a lesser extent than other agents, but can still be seen at high doses. Lastly, I want to talk about blue-green coloration of the urine, saliva, sweat, and even the whites of eyes may occur. This is definitely something to warn a person taking this medication about. This seems like a pretty important drug. Now let's go over to Stephen to discuss drug interactions.
Thank you, Jason. Mitoxantrone interacts with myelosuppressive agents such as clozapine and chloramphenicol. Immunosuppressive agents such as tacrolimus, roflumilast, and natalizumab, and cyclosporin, which leads to an increased serum concentration of mitoxantrone. A solution to this problem would be to decrease the dose of mitoxantrone if they must be used in combination. That is all for the interactions. Now let us switch to Mavis for the pharmacokinetic parameters.
Thanks, Stephen. Mitoxantrone exhibits pharmacokinetic parameters such as poor oral absorption, hence IV route administration. Mitoxantrone distributes widely into many organs, including the kidney, the liver, heart, thyroid, bone marrow, pancreas, spleen, and red blood cells. This drug has a protein binding of 78%, and this drug is mainly metabolized by the liver with a elimination half-life of about 75 hours. Lastly, this drug is excreted mainly through the feces and urine. And now over to Mike to talk about mitoxantrone's mechanism of resistance.
So, thanks, Mavis. As mitoxantrone is in the anti-tumor class of anthracyclines, resistance can arise from several different factors, one of which is PGP and other similar proteins to it. Now, these proteins exist in the cell membrane and act as efflux pumps, pumping the drug out and reducing the intercellular accumulation of mitoxantrone. Also, reduced topoisomerase II expression reduces the activity of the drug within the cell, of course. And then also increased DNA repair as a result of DNA damage can also be a resistance factor of mitoxantrone. Other than that, I think that's it for the resistance factors.